and I call the member for Franklin.
Thank you, Mr Speaker. Here in southern Tasmania, where I'm coming to you from today, we've just endured our first lockdown of more than a year since our last one, just 3 days that thankfully have been for no new COVID cases in southern Tasmania. But what it's done is get Tasmanians talking about our vaccination levels, talking about why here we are in the middle of October and still so few Tasmanians have had their vaccines. But I want to congratulate those Tasmanians who have gone out to get their vaccine. I think we're at 69% double dose now. I think we're 4th out of the 8 jurisdictions in Australia. But Tasmanians are particularly concerned about what happens when Tasmania opens up. When we hit that magical 90% our state premier wants, or 80% according to the national plan, we're still not sure yet what that will be. But we understand that our Premier will make an announcement this Friday about what the opening up plans for Tasmania will be. And what Tasmanians know is that we have the oldest population in Australia and sadly the sickest population in Australia, and that our hospital system here in Tasmania is already under great duress. We have a health system that is struggling to cope, whether it be accessing GPs around the state, in regional areas, in outer suburban areas, whether it be our mental health services or whether it be our hospitals and our ambulances. We know Tasmania's health system is not in good shape. We know that in August, less than half of all patients at the emergency department were seen on time. That is the worst result on record. We know that our ambulance response times are the slowest in the country. We know that ramping at our hospitals is a regular occurrence because we simply do not have enough staffed beds in our hospitals. We know that Tasmanians are already struggling to get the care they need, and Tasmanians are worried that when COVID and the Delta strain arrives in our shores in Tasmania, that we will not be able to cope. Now, we know, of course, that all state and territory ministers wrote to the Commonwealth asking for additional resources and funds, saying they need extra support for their health systems. In my home state of Tasmania, this is particularly true. We know that this support is needed. We know that Tasmania can't do it alone without the Commonwealth's support. We heard today in question time the Prime Minister say he's spoken to our State Premier. I hope that when the Premier announces Tasmania's plan on Friday about how we're going to reopen to the other states of Australia, that included in that is Commonwealth support for our health system. It simply cannot cope without additional support. The state and federal Liberal governments have had now more than 18 months to get this right. If Tasmania's hospital system fails under the weight of COVID when we reopen, it will be at the feet of the Prime Minister and the Premier. They will be responsible if Tasmania's health system does not survive this reopening. We've had assurances from the state government that they've purchased more ventilators. We've had assurances that there are enough trained staff. But we also know that last time we had COVID in Tasmania on the northwest coast in June last year, the federal government had to call in the army to actually deal with the hospitals on the northwest coast because the system could not cope. I hope since that time that the state and federal governments have done their jobs. The Tasmanian public is very anxious and very concerned about what it will mean when we reopen the borders here and that Delta, the COVID strain of Delta, comes into our state. Tasmanians, I urge you to go out and get vaccinated. We know that far too many Tasmanians are still not vaccinated, particularly in some of those regional communities, particularly some of the vulnerable groups. We have had to raise particular circumstances to get people access to vaccines. That should no longer be an issue. We know the state government has finally got round to getting a bus to go and visit in regional communities. But I urge every Tasmanian to please go and get vaccinated. Once you hear the Premier's plan on Friday, please don't panic. We're doing everything we can to put pressure on the state and federal governments to make sure that our health system in Tasmania will cope, that people will be able to access GPs, that people will be able to access the hospital emergency department when they need it. But far too many Tasmanians are wondering what will happen, will it work? And they haven't yet had any assurances from the state and federal governments about how this is going to work. So I hope that on Friday, when we get the big announcement about when Tasmania will reopen, that the government's done its
Member's
job.
time has concluded. The question is the